The state's Department of Child Services is getting ready for a surge of COVID-19 cases and how to protect children while their parents are sick. RTV6 reporter Kara Kenny joins us now with how they are getting ready and what you can do to protect your own family.
The Indiana Department of Child Services is preparing for a surge in COVID-19 toward the end of April and into May. When parents get sick, their children have to have somewhere to go, and DCS wants to be prepared for that. Dave Hancock and his wife have two boys.
One celebrates his 4th birthday next week, and the other turned 2 in October.
They've been Indiana foster parents for 6 years. The Hancocks are just one of thousands of foster families contacted by the Department of Child Services to find out if they could take a child who's been in contact with COVID-19 or who is COVID-19 positive.
I think it's Indiana preparing for a possible surge, and it's also Indiana preparing for the inevitable that comes with this sort of situation.
Dave had to say no because his wife has asthma and one of their foster sons has a heart condition.
It was hard to say no that we couldn't accept a child with that when we strive to have an open and loving home, but you can't take care of other people if you can't take care of yourselves.
Private agencies and nonprofits like The Villages are also working to find families willing to help children displaced by COVID-19.
We're trying to be really, really proactive.
The Villages is also doing training and informational sessions via Zoom for people interested in fostering.
We're trying to use this time to build the capacity that we feel both the Villages and Indiana is going to need to protect our children, to keep them safe, and most importantly, to keep them loved and nurtured during this time that's so stressful.
DCS released a statement to RTV6 to ensure the safety of Hoosier children. DCS needs to understand the capability of their foster parent community to house children who potentially have been exposed to the virus. We want to have meaningful conversations with foster parents about their own risk factors and give everyone the opportunity to discuss as a family what is best for them. DCS says the best response is to have a family safety plan in place. Have someone in your support network ready to go in case you get sick, and also someone who can help you care for your children. Kara Kenny, RTV6.
Kara, thank you. And if you are interested in becoming a foster parent or you need more tips on creating a safety plan for your family, go to this story on the RTV6 app and the IndyChannel.com.